If you're having abdominal pain after meals or suffering from chronic bloating or nausea, or even what you think might be acid reflux, you clicked on the right video. I'm going to explain what could be causing this is your gallbladder. So we're going to talk all about how your gallbladder works, what it does, and how to fix it. Hi, I'm Dr. Cori Stern, and this is my channel, Take Control of Your Health. Thank you so much for watching. If you haven't yet had a chance to hit the subscribe button, please do it now. And by the end, if you've liked the video, if it helped you, please don't forget to hit the like button. And most importantly, share this video with anybody that you know that you think needs to hear the information. So let's get started talking about the gallbladder. So first of all, and make sure you watch till the end because I'm going to give my top tips at the end of the video. So let's talk about what your gallbladder does first, where it's located. So it's tucked up under your liver, which is under your right rib cage. And your liver produces a substance called bile, which helps to emulsify or break down fat, the fat that you're eating. So fat has to be broken down into small enough globules that your intestines can absorb it and use it for nutrition. So if you want some more information about fat and why it's important to eat it, I have a lot of videos that talk about this, but one of them is called Fat, Is It Good or Bad? And I'll put a link to that video in the description of this one. I also talk a lot about the importance of fat in my video about how to keep your memory and brain function working. So your brain is made out of fat, mostly fat. So the bile that your liver makes, it gets secreted by the liver and then it gets stored in the gallbladder. So the gallbladder is a storage unit for bile, just like your urinary bladder is a storage unit for urine. So when you eat fat, the gallbladder contracts and it squeezes the bile through a duct that then goes into the small intestine and helps to break down the fat that you've just eaten. Bile is made out of water and cholesterol and something called bile salt and pigments. The main one is called bilirubin. Bilirubin is actually what makes your pee yellow and your poop brown. Sure, you always wanted to know that. So there are a lot of things that can go wrong with the gallbladder, and it's something that I see very often. So people come in with indigestion. They might have symptoms of either what they tell me is acid reflux, so they literally feel something coming up, sometimes as far as their mouth. Some people, throw up in their mouth. Or they just feel it here, they feel a burning sensation. A lot of people have chronic bloating or pain. So the gallbladder can cause pain under your right rib cage where it's located, but it can also radiate pain, to your back, to your right shoulder blade, the tip of your right shoulder blade. It can actually radiate pain across to the other side, to the left side, where your pancreas sits. So the gallbladder and the pancreas work together to digest fat. So just abdominal pain after you eat, nausea is a big gallbladder symptom, gas, a lot of burping. These are all symptoms of gallbladder, and chronic gallbladder symptoms can be a little bit strange. You can have nightmares. You can have the skin peeling on the soles of your feet. Dry skin is a chronic gallbladder symptom. and even memory loss, because if your gallbladder is not doing its job properly, your brain is going to end up getting affected. And there's another gallbladder symptom, weird chronic symptom. Oh, sneezing. I know, it's so strange. Okay. So what can go wrong with your gallbladder? So number one, you can form gallbladder stones. And most people have stones, and the stones are really small and they don't necessarily cause a problem. But sometimes they get bigger, they increase in size, and as your gallbladder is secreting bile through the duct into the small intestine, if the stone is too big, if you have stones that are too big, they can get stuck in the duct. If they get stuck in the duct, your gallbladder is going to go into a spasm because it's trying to squirt the bile into the bile duct to get it into the small intestine, and it can't go through. So that's going to cause pain. And secondarily, it's going to prevent bile from getting into your small intestine, which is going to cause you to not digest the fat properly. And when you don't digest fat properly after a meal, you're not going to feel good. You're going to get queasy or nauseous. You might get diarrhea. Long-term issues with fat absorption can also cause constipation. So definitely affects your bowel movements. Let's see what else. So nausea, bloating, right? So all of that. And then if over time you're not secreting your bile properly into your small intestine, you can end up with a hormonal imbalance. Your hormones need fat to be produced properly. Hormonal imbalance, you can end up with dry skin and cognitive issues, as we already discussed. All right, so gallstones are made out of calcium, or they can be made out of a combination of cholesterol and bilirubin, or all of the above. So what can cause gallbladder stones to form and be too large? Generally speaking, it all ends up being connected to a poor diet, inadequate fluid intake, so dehydration plays a role, but eating the wrong foods, drinking too much alcohol, all right, which also causes dehydration. And we'll talk a little bit more about the causes in a couple of minutes. So another problem that your gallbladder can suffer from is called sludgy bile. So that's the stuff that actually forms the stones can just sit in your gallbladder like kind of sand or sludge, and it causes the bile to get thick. And so it's the bile itself, it's more difficult for it to be secreted into your intestine, and it's just going to be, the bile is going to be less effective. The gallbladder is going to be overworked, and your fat is not going to be digested properly. And again, what causes sludgy bile? The answer is going to be the same as creating gallstones. It all comes down to eating the wrong stuff. The third thing that can go wrong with your gallbladder is just inflammation, an inflamed gallbladder, the actual tissue of the gallbladder itself being inflamed. So stones and sludge can cause inflammation. So can pregnancy, so can infection, right? So any kind of infection that we're talking about, any kind of pathogen that the body is struggling with, can cause an inflammation in the gallbladder. And then poor food choices, which is what we're always going to come back to. So the liver and the gallbladder are closely related. They work together. I would say the liver is like the boss of the gallbladder, I would say. The gallbladder is the helper guy. So if your liver is not happy, and what makes an unhappy liver? Well, it's the main organ of detox, right? So toxicity makes it unhappy. poor food choices, a very high carb diet, consumption of high fructose corn syrup is terrible for the liver, too much alcohol consumption. And then everyday toxicity exposure, like the chemicals that you're running into in your daily life, household cleaning products, personal care products, laundry detergent, medications that you might be taking, Tylenol, acetaminophen, also known as paracetamol, is the #1 cause of acute liver failure, right? So keep that in mind, that these over-the-counter drugs are not necessarily safe. Heavy metals that you may be exposed to. Of course, I cover all of this in detail on other videos, right? And how to clean it up. And we'll do a video just on detox, how to clean your liver out. But the point here is, if you're eating a high carb diet filled with toxins, your liver is going to be affected. It's going to affect the quality of your bile. It's going to make you more at risk for developing gallstones and sludgy bile and having inflammation and create these symptoms. And, the only solution that conventional medicine has for these issues is to take it out. When in doubt, take it out. You don't need the gallbladder, so just take it out. But we have other ways of fixing it, which I'm going to go over with you. So before I do that, I want to give a shout out to my truth partner, HATS, which stands for the Hardcore Awakened Truth Seekers movement. And they were inspired into creation amidst hyper political division in the past few years to get away from polarization and bring people together across the political spectrum to the truth and a sense of community that allows us to move forward. The movement is making real strides in achieving this vision. So I purchase products from them. They have a website, which I'll put a link to on the description of this video. And I love their products. I'm wearing their hoodie right now. I'm recording this video during the winter. So I drink out of my HATS mug all the time. And they have a lot of other cool things. You should just check out their site so you can support them. All their products are really high quality, and they have a Telegram channel too, if you want to take a look at that and be a part of this movement. So let's talk about my favorite things to do for fixing gallbladders. And I actually run into it a lot. One of the reasons I'm making this video is because of the very high number of people that I see with gallbladder issues. And I have a lot of success in getting them better. So the first product I want to talk about comes from my favorite supplement company, Standard Process, and it's called Beta Food. So beta is from beets, betaine. And what Beta Food does is it helps to mobilize and thin the bile. So it improves the quality of the bile. And it works really, really well if that's what the issue is, if you have sludgy bile, poor bile quality. Okay. Next is Choline. And choline is actually bile salt. It's actually bile. So bile, as we said earlier, is an emulsifier. It helps break down the fat. So if for whatever reason your body is struggling to either produce good bile or to secrete your bile, you can use this as a substitute until your gallbladder is working better. And it doesn't taste good. I'm just letting you know. It tastes like bile. It tastes like you threw up in your mouth. Which I want to say, by the way, I don't remember if I mentioned this, one of the symptoms that people come in with when they have gallbladder issues is what they say is acid reflux. So you can have acid coming up from your stomach, hydrochloric acid, or you could have bile coming up. All right. And some people, you can't really always tell the difference. If it actually comes out, you'll see that it's like, yellowish. That's how you can know it's bile. So very often acid reflux, bile issues get misdiagnosed as acid reflux. And then you get put on omeprazole or one of the proton pump inhibitors, the acid, what are they called? The medications that stop you from producing acid. And it doesn't work because that's not where the problem's coming from, right? Okay, so the next supplement that I love for gallbladder is called Choline. And choline is a form of vitamin B. It's part of the B vitamins. And this is also, it is an emulsifier, like a detergent. All right, so it breaks down fat also. And choline has other functions because it's a B vitamin. It actually is part of acetylcholine, which is a neurotransmitter. So it helps with brain function as well. I have found choline to be helpful in cases of chronic gallbladder issues where people are constipated. It seems to also help with bowel function. Next, from the herbal department of Standard Process MediHerb, we have this combination herb called Livton Complex. And Livton is a liver tonic with, it has, I think, 4 herbs in it, which I didn't write down. Globe artichoke, more than 4. Dandelion, milk thistle, bupleurum, and fringe tree bark. So they're mostly all herbs that help with production and secretion of bile, and they're liver protective and anti-inflammatory. So this helps both the gallbladder and the liver. Next is a supplement that I forgot to bring over to my computer to show you. It's called Phosfood, and it's a liquid. So it's actually phosphorus, and it breaks down, helps to dissolve gallbladder stones. Now, we have found that it helps with nausea also. So when you eat a fatty meal and your gallbladder's not working and you get queasy, put some Phosfood in water and drink it, and it seems to calm down that symptom temporarily. Next, I have this amazing supplement called, and this is not from Standard Process, it is from Whole World Botanicals, and this is called Chunka Piedra, which means breakstone. So it's called Royal Breakstone. It is from Peru, and it literally dissolves stones, not just in the gallbladder, but also in the kidney. So you could use it for either or. And it also helps as a liver support. And it apparently improves your cholesterol, the quality of your cholesterol too. It says supports a healthy LDL cholesterol level. So I have a lot of patients take this. I love this stuff. This helps, I said, gallbladder, kidney stones, and also bladder stones. And then the last thing I want to mention is something, again, that I forgot to bring over here. Shoot, sorry. Okay, and it's an essential oil. I use the company Young Living. You don't have to use that company. It's just whatever is in this particular oil. It's called Digize. And what's in it? What is in Digize? And I can't remember right now. I believe it has fennel in it. Let me just look it up for you. Sorry about this. Come on, be prepared here. Tarragon, ginger, peppermint, juniper, fennel, lemongrass, anise, and patchouli. And you just put it directly, like topically on the abdomen. I love this when you're having acute pain in your abdominal area. And you can actually also Inhale it. You know, when you are using essential oils, you can always try smelling them, and then you can actually drink this too. You can put a drop in water and drink it, either cold or hot water. So this is a good symptom manager. I'm not saying it's going to fix the gallbladder. The other supplements that I mentioned will fix it, but this is a great symptom manager if you're having attacks and you're trying to keep your gallbladder in your body and not end up having to go to the ER where they're going to just want to take it out. So that's all I have for now. I hope that this was helpful. Again, please hit subscribe if you haven't done that yet, and like the video because it helps other people to find it. And then please be sure to share this with anyone you know that's suffering from these symptoms. And we will see you again soon, please. In the meantime, stay healthy.